Now I'm going to finish briefly on COVID tongue. Now it's not the best picture in the world from the COVID symptom tracker app, but what seems to happen if you get these kind of these it's not a good picture at all, but you get these kind of white bits and these reddish inflamed bits in it. This phenomena which appears to be related to COVID. So let's have a quick look at that. It is quite intriguing. The COVID symptom tracker app, of course, a lot of people reporting in to this, and new symptoms have been discovered in this way. So previous reported mouth and tongue changes have been reported. Dry mouth, loss of taste, and fungal infections, of course, are really common anyway. We treat loads of these with normally nystatin antifungal mouthwash type things. It's like drops you put in your mouth and swill it round. Reports in changes in tongue sensation, muscle pain while chewing, swelling of the mouth, ulcers of the tongue or inner surface of the mouth and lips have been reported previously in previous research into this. So reporters asked to identify new features on the COVID symptom tracker app. I'm a reporter. Anyone who reports into it is such a person, and that's how we've learned largely about, or certainly quantified, loss of smell, skin rashes, and the confusion, the acute confusion that can occur, especially in elderly people with COVID. Tongue doesn't look normal, white and patchy in long COVID, not long COVID, COVID tongue, I'm still on the last article. COVID tongue is what to look out for, or indeed any other changes, because we're still understanding the clinical syndrome that is COVID. So what causes COVID tongue could be a direct viral effect or an immune response, as indeed we know this is the case with COVID-19. So here's data we've looked at a few times. This is from East Virginia Medical School. So we get this kind of the viral stage of the illness here, days 1 to 5, where there's viral replication going on. Here we get viral debris, but in this stage the virus is no longer alive. And here we get the immune dysregulation and the problems that can come as a result of the initial viral infection, as the immune system reacts in a way that we could probably describe as abnormal. Well, it is abnormal after getting rid of the virus. So really, once the virus has got rid of, the immune system should say, right, that's it, job done now. But we get this immune dysregulation that causes the problems. That's from the East Virginia Medical School diagram, which I find helpful. Right. So could be direct viral effect, or it could be the immune response. But that's true for everything related to COVID, so that doesn't tell us too much. That's like always true in COVID, really. Increased susceptibilities to fungal mouth infections, but don't seem to respond to antifungals. So it might not be that. It might be something else. So this might be a condition that looks a bit like this thrush infection, this manilial infection that we treat commonly. It might look like it, but it doesn't. It may not actually be a fungal infection. It might just something that looks like it. How common is it? Up to a quarter of hospitalised patients had tongue and mouth changes, right? So in the more severe disease, more cases. In the less severe disease, less common. That's why we have the COVID symptom tracker app with 1 million people reporting. We pick up these less common things. We don't know if it can be an isolated feature. When in the condition arises, does it occur early or late? And so that is now a question, and data is being collected on that. So for example, could it be a clinical feature that indicates that COVID-19 is present, and could that be the only symptom? Doesn't sound likely, but this is a strange disease, so that's possible. When in the condition does it arise early, in which case it might be a direct effect of the virus? Does it arrive after a couple of weeks? We don't know, but if it does arise after a couple of weeks, it could have been the immunological reaction rather than the virus itself, so data currently being collected on that. So that's a quick review of things related